Let me ask you something that might surprise you. Have you noticed your urine looking a bit foamy lately? Maybe dismissed it as nothing important? Well, I need to tell you something that could change everything about how you think about your kidney health. That foam might be your kidneys crying out for help, and today I'm going to share 9 powerful drinks that could actually reverse this silent problem before it's too late. You see, I've spent years working with patients who come to me devastated, wishing they'd known sooner about what was happening inside their bodies. And the truth is, your kidneys have been working tirelessly every single day of your life, filtering around 50 gallons of blood daily. But when they start struggling, they don't always scream for attention. Instead, they whisper through subtle signs that most people ignore until it's almost too late. Now, before we dive deep into these kidney-saving drinks, I want you to understand something crucial. Normally, your body is supposed to have less than 150 milligrams of protein in your urine over a 24-hour period. Think of your kidneys like a sophisticated coffee filter. They're designed to keep the good stuff in your blood while filtering out the waste. But when that filter starts breaking down, proteins that should stay in your bloodstream begin leaking into your urine. We call this proteinuria, and between you and me, it's one of the most underestimated warning signs your body can give you. When protein levels climb between 150 and 500 milligrams, we're looking at moderate proteinuria. Push past 500 milligrams and we've entered severe territory. Here's what really concerns me though. Most people don't feel anything different. Sometimes your urine might look frothy, like beaten egg whites. Other times you might notice swelling in your ankles or around your eyes. But often there are no symptoms at all, which is exactly why this is so dangerous. Let me paint you a picture of what's really happening inside your body. Your kidneys contain these tiny, delicate filtering units. When your blood pressure runs too high for too long, it's like turning up the pressure on a garden hose. Eventually, those filtering units get damaged, and proteins start slipping through the cracks. High blood sugar does something similar, attacking the small blood vessels in your kidneys like rust-corroding pipes. And cholesterol? It builds up along your artery walls like sludge, choking off the blood supply your kidneys desperately need to function properly. This is precisely why keeping your blood pressure, blood sugar, and cholesterol in check isn't just good advice. It's absolutely essential for kidney survival, and this is where these 9 drinks come into play. They're not magic potions, but they're pretty close when it comes to supporting your kidney health naturally. Here's a question I get all the time. Doc, can I really make a difference just by changing what I drink? Absolutely, yes. What you put into your body matters tremendously, and sometimes the simplest changes create the most profound results. But remember, before making any significant dietary changes, especially if you already have kidney concerns, please talk with your doctor. Your individual situation matters, and what works beautifully for one person might need adjustment for another. Now, let's talk about these 9 powerful drinks. I want you to grab a pen because you're going to want to remember these. Starting with number 9, we have berry smoothies. Not just any smoothie, mind you, but a carefully crafted blend of kidney-friendly berries. Each berry brings its own superpower to the table. Strawberries, for instance, are packed with compounds called anthocyanins. These are nature's firefighters, putting out the flames of inflammation and oxidative stress in your body. When inflammation attacks your kidneys, these antioxidants step in like bodyguards, protecting those precious kidney cells. Plus, the nutrients in strawberries actually help lower your cholesterol, preventing that dangerous buildup in blood vessels that chokes off circulation to your kidneys. Blueberries take this protection even further. A single cup of cultivated blueberries contains over 9,000 antioxidant units. Wild blueberries? They're even more powerful, delivering over 13,000 units per cup. That's an army of protection in a tiny package. The fiber in these berries works like a broom, sweeping cholesterol out of your blood and helping your body eliminate it naturally. Then there's honeysuckle berries, which might help your kidneys filter out heavy metals and drug toxins. Think of them as giving your kidneys a helping hand with the dirty work. And acai berries, those dark purple powerhouses you can find frozen in most grocery stores, bring even more antioxidant firepower to protect your cells from damage. Take a moment and write in the comments below. Berries. If you're going to try making a kidney-friendly smoothie this week, I read every single comment, and your commitment helps keep you accountable. When you're making your berry smoothie, here's my insider tip. Go organic whenever possible. Some conventional berries carry high pesticide levels, and those chemicals can actually burden your kidneys further. If organic isn't available or affordable, look for products marked IPM, which stands for Integrated Pest Management. These farmers use pesticides only as a last resort. And if you buy conventional berries, soak them in filtered water with a bit of baking soda or lemon juice for about 15 minutes. This simple step removes most pesticide residues. One more thing about berries: dried versions don't count. The drying process concentrates the sugars while reducing the beneficial compounds. Stick with fresh or frozen for maximum kidney benefits. Moving to number 8, we have turmeric milk, also called golden milk. This ancient remedy has been used for thousands of years in traditional medicine, and modern science is finally catching up to what our ancestors knew instinctively. The active ingredient in turmeric is curcumin, and this compound does something remarkable for your kidneys. Inside your body, inflammation triggers through chemicals called cytokines. These cytokines can damage your kidney's filtering system, creating those leaks that allow protein to escape into your urine. Curcumin blocks these cytokines, essentially shutting down the inflammation before it causes more damage. It's like having a security system that stops the burglar before he breaks in. Research has shown that curcumin also protects your kidneys from high blood sugar damage and oxidative stress. In one fascinating study, scientists gave rats a drug known to damage kidneys. Some rats received turmeric and ginger beforehand, and those lucky ones experienced significantly less kidney damage. The turmeric acted like a shield, protecting the kidney cells from harm. To make golden milk, simply mix 1 to 2 teaspoons of turmeric with warm milk, add a pinch of black pepper, some cinnamon, and a touch of honey or maple syrup. Heat it gently for about 10 minutes. The black pepper is crucial because it helps your body actually absorb the curcumin. Without it, most of the curcumin just passes through your system unused. You can also add turmeric to meals containing healthy oils, which further boosts absorption. Quick question I hear often: is turmeric safe for everyone? Generally, yes, when used as a cooking spice. However, pregnant or breastfeeding women should stick to normal food amounts and avoid large supplemental doses. And if you're on blood thinners, please check with your doctor because turmeric can increase bleeding risk when taken in high amounts. At number 7, we have pomegranate juice. This ruby red drink contains 3 times more antioxidants than green tea. Just let that sink in for a moment. 3 times? All those antioxidants work together fighting the inflammation that worsens proteinuria. Pomegranates also deliver a healthy dose of vitamin K. 1 cup provides about 29 micrograms, and you need around 120 micrograms daily. Here's why this matters. Chronic kidney disease often leads to vitamin K deficiency, which causes heart and bone problems. Low vitamin K levels also seem to worsen kidney disease itself, creating a vicious cycle. By drinking pomegranate juice, you're breaking that cycle. Studies with rats showed that pomegranate juice protected kidneys from damage caused by lithium, a medication that can harm kidney function. The juice lowered creatinine levels, a marker of kidney damage, and reduced urea levels in the blood. This protective effect comes from the incredible variety of antioxidants in pomegranates, including vitamin C, vitamin E, anthocyanins, and several unique compounds that shield your kidneys from oxidative stress and heavy metals. If I could shout one thing from the rooftops about proteinuria, understanding how vital these drinks are would be right at the top. But here's what most people don't realize. Consistency matters more than perfection. You don't need to drink all 9 of these every single day. Pick 2 or 3 that appeal to you, make them part of your regular routine, and your kidneys will thank you for years to come. And speaking of consistency, if you're finding value in what we're discussing today, do me a favor, hit that subscribe button right now. We release new videos every week packed with practical science-backed information that could genuinely change your health trajectory. Don't miss out on content that could add healthy years to your life. Your future self will thank you. Now, pomegranate juice also helps regulate blood pressure naturally. The reductions might seem small, only about 5 points on the top number and 2 points on the bottom number, but over time, these small changes compound into significant kidney protection, and those natural potassium levels in pomegranate, they help balance sodium in your body, further supporting healthy blood pressure. One important note though, always choose fresh pomegranate juice over bottled versions when possible. Making your own juice avoids the added sugars and preservatives that manufacturers sneak into bottled products. Pomegranates taste naturally sweet and tangy, so you don't need extra sugar anyway. Number 6 brings us to lemon water, one of the simplest yet most powerful drinks for kidney health. Lemons deliver potassium, which helps regulate blood pressure by balancing sodium levels in your body. This protects those delicate filtering units in your kidneys and reduces protein leakage. Drinking lemon juice also improves digestion and metabolic health, potentially helping regulate blood glucose. Stable blood sugar levels reduce your risk of diabetes, which is one of the most common causes of kidney damage and proteinuria. The phytonutrients in lemons act as antioxidants, protecting kidney cells from oxidative stress damage. And vitamin C, abundant in lemons, helps repair cell injuries and improve cholesterol levels. Here's something fascinating. Lemons increase your citrate intake. Research shows that citrate decreased proteinuria in diabetic rats. Citrate also binds to calcium in your digestive tract, preventing calcium oxalate crystal formation, the main component of kidney stones. While kidney stones don't directly cause proteinuria, preventing them improves overall kidney health and helps manage protein leakage. Making lemon water couldn't be easier. Squeeze 1 lemon into about 5 ounces of water every morning. You can also zest the peel for baking or cooking to capture even more benefits. For the best lemon water, choose firm, bright yellow lemons with shiny, thin skin. Heavier lemons usually contain more juice and flavor. Room temperature lemons yield more juice than cold ones. Write lemon in the comments if you're going to start your mornings with lemon water. Let's see how many of us commit to this simple change together. Worried about tooth enamel? Don't be. Diluted lemon water is perfectly safe unless you're drinking excessive amounts constantly. For extra protection, sip through a straw and rinse your mouth with plain water afterward. Pregnant women can safely drink lemon water too, making it a versatile choice for almost everyone. Number 5 is cucumber juice. Cucumbers have been used in traditional medicine for ages to treat various ailments, and they offer specific benefits for proteinuria. Cucumbers contain soluble fiber and mostly water with minimal calories and sugar. This combination helps your body regulate blood sugar naturally. The antioxidants in cucumber, including cucurbitacins, beta-carotene, and quercetin, fight inflammation and oxidative stress. Cucumbers also help cleanse your body by removing accumulated waste and toxins, easing the burden on your kidneys. This leaves your kidneys more energy for their other critical functions. Cucumbers have an alkaline nature that helps balance your body's pH levels, keeping your blood pH in the normal range. As we age, our kidneys may struggle to maintain this balance, and blood tends to become more acidic. Excessive acidity contributes to weak bones, high blood pressure, heart disease, and memory problems. Cucumbers also act as a natural mild diuretic. Studies showed that cucumber extracts from the flesh and rind had similar effects to prescription diuretic medications. The diuretic effect was even stronger when the entire fruit was used. Since cucumbers are 95% water, they keep you hydrated and help maintain healthy blood pressure. Water-rich foods like cucumbers provide vital nutrients for repairing and strengthening cells, including those precious kidney cells. Add cucumbers to juices or smoothies to preserve their kidney-friendly nutrients. Try enhancing cucumber juice with fresh ginger, kale, celery, lemon, apples, or pineapples. These additions create refreshing flavor combinations while boosting antioxidant benefits. When shopping for cucumbers, pick slender, firm ones with medium to dark green color. Yellow spots indicate they're overripe. Number 4 is beetroot juice. Beets contain powerful antioxidants including betalains, vitamin C, and nitrates. Betalains protect against kidney injury and the effects of high blood pressure, both known causes of proteinuria. Beetroot has demonstrated positive effects for people with chronic kidney disease, including reducing blood pressure, decreasing inflammation, and reducing oxidative stress. One study found that patients with high blood pressure who drank about 8 ounces of beetroot juice daily saw their blood pressure return to normal levels after 4 weeks. This remarkable effect came from the high levels of inorganic nitrate in beets, which helps widen blood vessels and improve blood flow. When buying beets, look for roots with good ruby color and firm texture. Medium-sized, round beets are best. Choose beets with small tops and tails and bright green tops if still attached. Don't waste those greens, toss them in salads for extra nutrition. If you're not crazy about beet flavor, add some lemon juice. A good starting ratio is 2 beets to 1 lemon, but adjust to your taste. Just remember that beets are high in potassium, so if you have kidney disease, consult your doctor about appropriate amounts for your situation. Number 3 brings us to ginger tea. Ginger has been widely used to ease nausea and vomiting, but studies have demonstrated powerful anti-inflammatory and antioxidant effects. Ginger protects kidneys and reduces proteinuria through multiple mechanisms. Research has shown ginger helps manage type 2 diabetes, obesity, and arthritis. These conditions promote inflammation and high blood sugar, 2 common causes of protein leakage into urine. In one clinical trial, patients undergoing peritoneal dialysis who consumed 1 gram daily of ginger for 10 weeks showed up to a 20% decrease in fasting blood sugar levels compared to baseline. Ginger also improves blood lipid levels and favorably affects blood pressure. The antioxidants in ginger, including gingerol, shogal, and zingerone, reduce oxidative stress throughout your body. Studies on rats showed that ginger extract significantly improved kidney function and antioxidant status after exposure to cadmium, a heavy metal that causes kidney toxicity. Ginger tea makes a perfect after-dinner treat, but commercial ginger teas often contain added sugars or additives. The tea in those bags also offers fewer antioxidant benefits due to processing. Choose fresh ginger instead, and add a little lemon or lime juice for an extra kidney-friendly boost. Here's another question I get asked constantly. What about ginger supplements? Ginger supplements provide much higher doses of active compounds than fresh ginger, and evidence suggests they might increase bleeding risk. If you're on blood thinners, be cautious with supplements, though fresh ginger in normal food amounts is generally safe. Always discuss supplements with your doctor. Number 2 is cranberry juice. Cranberries have a long-standing reputation for promoting urinary tract and kidney health. Scientists discovered that cranberries prevent bacteria from sticking to cell membranes in the urinary tract, potentially reducing UTI risk. These effects come from antioxidants like anthocyanins and proanthocyanidins. Cranberries also provide vitamin K, which recent research suggests might help treat chronic kidney disease-related bone and heart disease. Though optimal dosage remains unclear, getting natural vitamin K from cranberries is an excellent option for kidney disease patients. Cranberries are safe for people with chronic kidney disease because they contain low levels of potassium, phosphorus, and sodium. 1 cup of cranberries provides only 1 to 2% of the recommended daily value for these minerals. When choosing cranberries, pick ones that feel firm and bouncy. Good cranberries look slightly opaque with a bright scarlet or deep red color. Brighter hues mean riper, more beneficial berries. Don't wash cranberries before refrigerating or freezing. Rinse them right before use. Managing fluid and sugar intake is crucial for kidney disease patients. Balance the amount of cranberry juice with your overall fluid needs and avoid store-bought juices with added sugar. Ask your doctor to determine your optimal intake. Finally, number 1 on our list is green tea. This widely popular drink made from unprocessed leaves has been shown to reduce cholesterol levels, blood sugar, and blood pressure. Drinking green tea is like giving your kidneys a spa treatment. Unlike other teas, green tea retains most of its natural antioxidants, particularly catechins, which are excellent at neutralizing free radicals and reducing inflammation. The polyphenols in green tea also improve how your body uses insulin to manage blood sugar. Research investigated a catechin in green tea called epigallocatechin gallate, commonly known as EGCG. Evidence demonstrated that EGCG shows promise for treating or preventing acute and chronic kidney disease, kidney injury, nephrotoxicity, and kidney stones. However, most research has been limited to animal studies, so more clinical trials are needed. Human studies show better results with 3 to 4 cups of tea daily, providing 600 to 900 milligrams of catechins. Green tea does contain caffeine though. Healthy adults can safely enjoy up to 400 milligrams of caffeine daily. One typical 8-ounce cup of green tea contains about 30 to 50 milligrams of caffeine, compared to 80 to 100 milligrams in the same amount of coffee. Since caffeine can stay in your body for up to 6 hours, avoid green tea late in the day. Enjoy it in the morning for a nice energy boost without disrupting your sleep. Choosing quality green tea matters for kidney health. Pick loose leaf tea instead of tea bags. Tea bags often contain lower quality leaves, and processing reduces polyphenol benefits. The more specific the name, generally the higher the quality. Generic green tea is probably low quality, while varieties with specific names like Gyokuro indicate higher quality. Consider the water you use too. Water with neutral pH is ideal for brewing green tea. Higher pH leads to oxidation and degradation of catechins, while lower pH can reduce aroma. Water with fewer minerals produces better tasting tea. Mineral-rich water can make tea stronger and more bitter, while reducing the volatile compounds that give green tea its distinctive flavor. Now, before you rush off to try all 9 of these drinks, we need to talk about important precautions. Curcumin is generally safe at recommended doses, but long-term use can lead to stomach upset, peptic ulcers, and increased bleeding risk, especially with blood thinners. If you experience persistent stomach issues or take blood thinners, consult your doctor before consuming turmeric products regularly. The acid in lemons can harm tooth enamel if consumed excessively without dilution. Dilute your lemon juice with water and avoid sipping continuously. If you notice increased tooth sensitivity or enamel erosion, discuss this with your dentist. Pomegranates and beetroots are rich in potassium, which can cause trouble for some people with kidney disease. Unhealthy kidneys may not filter potassium effectively, causing high potassium levels in blood. This can lead to chest pain, difficulty breathing, kidney failure, or even cardiac arrest. The good news? Not all kidney disease patients need to limit potassium intake. In early chronic kidney disease, higher potassium intake may actually help slow disease progression. If you're on dialysis, you might need to consume more potassium rather than limiting it, depending on your specific treatment type. Before trying pomegranate or beetroot juice, consult your nephrologist or dietitian to determine appropriate amounts for your condition. Generally, people with kidney disease can enjoy these foods if their blood potassium levels aren't elevated. Beets are also high in oxalates, which can contribute to kidney stones. If you're at risk for kidney stones, enjoy beetroot juice in moderation. Inform your healthcare provider about all drugs and supplements you're taking, plus any dietary changes you're making. They need to know about alternative therapies you're using to prevent harmful interactions and ensure your safety. Let me wrap this up by saying something important. Proteinuria isn't a death sentence. It's a warning sign, your body's way of telling you that your kidneys need support. The excess protein in your urine signals underlying issues, often caused by chronic conditions like diabetes and hypertension. But here's the empowering truth. You have more control over this than you might think. Preventing and managing proteinuria involves addressing underlying conditions medically while maintaining kidney health through diet and lifestyle changes. Incorporating these kidney-friendly drinks into your daily routine can genuinely support kidney function. These beverages contain antioxidants, anti-inflammatory properties, and beneficial compounds that help reduce protein levels in urine and protect against further kidney damage. These drinks are generally safe for most people, but if you have kidney disease or any other health issues, inform your doctor about dietary changes, even small additions like new drinks. Your individual health situation requires personalized guidance. I want to thank each one of you for taking the time to read through this entire article. Your commitment to your health inspires me to keep creating content that makes a real difference in people's lives. Knowledge is power, but only when you act on it. Choose 2 or 3 of these drinks that resonate with you and commit to making them part of your routine starting this week. Before you go, I need you to do something crucial for your continued health journey. Subscribe to our channel right now if you haven't already. We release comprehensive, science-backed videos every single week covering everything from kidney health to heart disease prevention, diabetes management, and so much more. Turn on notifications so you never miss content that could literally save your life or the life of someone you love. We're building a community of people who refuse to be victims of preventable disease, and I want you to be part of that movement. Your kidneys have been working tirelessly for you every single day of your life. It's time to return the favor. Start with 1 drink today and build from there. Small, consistent actions create remarkable transformations over time. You've got this, and I'm here with you every step of the way. Stay informed, stay proactive, and most importantly, stay healthy. I'll see you in the next video.